General postoperative instructions. Sedated patients. Patients who have received IV sedation should return home from the office upon discharge and lie down with the head elevated until the effects of the anesthesia have worn off. Do not use tools, appliances, or equipment that could be dangerous. Do not drive. Walk slowly and take your time. Do not make legal decisions or agreements. No signing contracts or other legally binding documents. Do not drink any alcoholic beverages. It is important to stay hydrated following surgery. You may drink clear liquids, e.g., water, Sprite, ginger ale, etc., for the first 24 hours. If these liquids do not make you nauseated, you may proceed to eating soft foods. Wound care. Continue biting on gauze for 1 to 2 hours after surgery or until the bleeding has stopped. Place fresh gauze every 20 to 40 minutes and bite down firmly. If bleeding continues beyond 2 hours, you may bite on a moistened black tea bag for 30 minutes. If bleeding is excessive or persistent, please call our office. Do not continue to use gauze once the bleeding has stopped. Do not drink through a straw or spit. To minimize swelling, cold packs or ice bags can be wrapped in a towel and applied to the face adjacent to the surgical area. This should be applied for 20 minutes and then removed for 40 minutes during the first 24 hours after surgery. Tightening of the jaw muscles and bruising may also occur. Try to keep lips moist with ointment to prevent cracking or chapping. Hygiene. After 36 hours, you may begin warm saltwater rinses of your mouth to promote healing. Do not spit. Just allow the rinse to fall out of your mouth into the sink. After 7 days of the healing process, you may gently irrigate the bottom wounds using your irrigating syringe if provided. Use warm salt water in the syringe. Place the tip a quarter of the way into the wound and slowly irrigate until the water is clear. Do not over-irrigate or you may prevent the healing process. Use the syringe every day until the wounds are closed. Please refrain from using an electric toothbrush on the surgical sites. Activity. Please plan on resting for at least 2 days after surgery. It is best to take it easy for several days and not exercise or play sports for 1 week. Do not smoke for at least 72 hours after surgery. Diet. While you are still numb, avoid foods that are hot or need to be chewed. If you are a diabetic, maintain your normal diet as much as possible and follow your physician's instructions regarding your insulin. A soft diet should be followed for several days following your procedure. Medications. Take your medications as prescribed by the doctor. We advise you to take a planned medication within 2 hours of your surgery, before the numbness wears off. Taking the planned medication with food or water will lessen the side effects of nausea or stomach aggravation. If you were prescribed an antibiotic and are currently taking oral contraceptives, you should use an alternate method of birth control. Orthodontic appliances. If you wear orthodontic appliances, replace them within 24 to 48 hours. Don't be surprised if they are difficult to reinsert. Dry sockets. This usually occurs on the 3rd to 5th day after surgery. There will be a noticeable, distinct, persistent pain in the jaw area. This may be accompanied by a bad taste in your mouth. If you notice any of these symptoms, please contact the office immediately. Infection. This is unlikely to occur, but it is important to call the office if you experience fever, night sweats, or a significant increase of pain or swelling. Numbness. Loss of sensation of the lip and chin may occur, usually following lower wisdom teeth removal. This is usually temporary and disappears within the first few weeks. Rarely, some numbness may persist for months. Please report these symptoms to the office as well. Sinus perforation. Do not disturb the blood clot in the socket from which the tooth has been removed. Do not blow your nose. Avoid anything that will cause you to sneeze or cough. If you need to sneeze or cough, do so with your mouth open. Do not be alarmed if you find blood in your nose. This may happen occasionally since the nose is connected directly to the sinus.